If you have ever been sick and you went to the hospital, you were referred to the lab, possibly due to an infection. In fact, all this happened. A drug was given to you. You took this particular drug, it worked. In fact, you have known this drug to be working. Then a time came, when you took this particular drug, you found out that it's no more working. Then this video is for you. What are you trying to talk about? Antimicrobial resistance. These people that come again. That come again with their grammar. Which one is antimicrobial resistance? Calm down. Antimicrobial resistance in its simplest form is when the germs, example bacteria in your body, have grown so big, have become so much energized, are now superpowers. They are now stronger. They have grown so much strong that they are now stronger than the antibiotic that is meant to work against them. They have become so strong and powerful that when they see antibiotics, they'll take it and do like this and throw it away. That exactly is what antimicrobial resistance is all about. In the year 2025, just few days ago, in the year 2025, WHO said that 1 in 6 infections are now resistant to antibiotics. 1 in 6. If we had said 1 to 2, if we have said 1 to 200 or 1 to 100, you could have said, I beg, it's not close. I don't know what they're talking about. But 1 in 6 is so close. It's so close. 1 to 6 infections are now resistant to antibiotics. What are the causes of all these things? What is this one again? Person no go fit drink water and keep cup for this world. One major cause of antimicrobial resistance is that thing that you have been doing. What is that thing? You go to doctor, you are sick. You go to doctor will refer you to the you write your prescription. You go to the pharmacy, they'll give you your drug, and you come back home. Your prescription must have said 1 daily for 7 days. Then you carry your drugs and you went home. You are trying to be religious because you don't want to keep being sick. You took day 1, day 2, day 3. Let's say day 3, your body is now doing you like it's like I'm now getting better. It's like I'm getting better. You're not yet sure. You took day 4. Hey, you tell yourself, I beg, this sickness who you? I beg this drug and stay one side. You carry your drug and throw away. Come close. We are not done. Let me tell you what you have done. Let's say you, as a soldier, you are sent to a particular place to clear, to scatter, to clear, to destroy anything that you see there. You went there so equipped. Then you started fighting. You started destroying. You started killing the animals first. Killing them. You destroyed all the animals in that place. Then all of a sudden you ran away. What do you think that the people there are going to do? Of course, they will retreat. They will become so stressed. Say, this person that had the mind to come into our territory and start killing our animals, what is the mind of this person? Are we going to stay and wait for this person to come back again? And no, we are not going to do that. They will retreat on their own and become more energized. They will go and train more soldiers and wait for your return. That is what is happening in your body. And then eventually, you keep doing this. You take your drug. The drug will start working. Start killing the weaker bacteria, weaker germs. And then you suddenly stop. The ones remaining, what do you think they are going to do? Definitely, they will build more stronger forces and wait for your return. And you keep doing this, it will become a practice. Time shall come when you take that particular drug, it won't work anymore. Why? Because the ones that you ended up not killing have eventually become powerful that when they see that, they say she be na this thing wey come that time come threaten us, abeg, they will take that antibiotic and throw it away because that had become so strong. Again, when you have something like flu or cold, cough, you have now decided that you are going to self-medicate. You go to chemist, abeg mix this one for me, mix am for me, then go mix am for you, go take am. In the long run, you are misusing this drug and you have your body to suffer for it in the future, because when time will come when that drug we have been misusing will be needed to do and treat a more serious sickness, more serious issue, more serious infection, your body will resist that drug. Leftovers, what do you take a drug, you take half, you keep, then later, let's say your sister will not say, it's like my body is doing me one kind, then you at your end will not say, it be like saying that thing wey do me that time they do you. You don't say, yes, that even that drug where I take that time, the drug is remaining. You go and get it. Maybe a drug that was meant to last for 7 days, is now remaining just 3 tablets or 4 tablets. You give to your sister will take. That one also will feel better. We feel like she's feeling better after 2 or 3 days. And just like that, you keep misusing drugs. Again, what causes this? Agriculturists. If you know anybody that rears animals, if you know any agriculturist, send this video to them. In fact, carry that person, come, make the person watch this video. Many agriculturists now misuse antibiotics. You use antibiotics when they're not necessary, because you have many livestock, you don't want them to die, and because of that you keep bombarding them with antibiotics. Because you want them to grow well, you keep bombarding them with antibiotics. At the end of the day, who are the end consumers of this animal? Who are the end consumers? Or let's say poultry of these chickens, who are the end consumers? It is us. You go chop the chicken, enjoy am, not knowing that the antibiotics that was used to prevent whatsoever sickness before the chicken was sold to you has now entered into your system. What are the problems? As all these things are happening, what are the problems these things can cause us? Of course, it can cause death. Yes, it can cause death, because when a particular drug that was meant to do what's meant to do, when you now take it and eventually you find out that drug is no more working, the doctors will start running around trying to look for a better drug. Depending on the seriousness of the sickness, somebody can die out of it. You know, longer hospital stays. A drug that took you to the hospital, a sickness that took you to the hospital, maybe you were admitted day 1, day 2. On a normal 2-3 days, are meant to get better. But because the known antibiotics are no more working, doctors will keep running helter-skelter, trying to save your life, extending your stay in the hospital, and equally extending your costs. Because when you're in the hospital for day 1, and you're meant to pay 20,000, at the end of the day, you saw that you stay in the hospital for 5 days. Are they the same cost? Then again, let's say, God forbid, something happened that, let's say, later in your life, something happened that a surgery was meant to be performed on you. Normally, there are some known antibiotics that are meant to be used for this procedure, or let's say chemotherapy, and then eventually they found out that these drugs are no more working. Have we seen the trend? Have we seen how dangerous this can be, especially in the long run? Because you may be doing it and you feel like you're not doing anything. So in all this, how can we save ourselves? One, when you are given a particular drug, please try as much as possible to finish it. If you are being told 7 days, be religious with it and take your drugs for 7 days. If you know any agriculturist, please pass this. If you know them or you are one, don't give antibiotics when it is not needed. Don't say because they are crowded, don't say because this or that. You now bombard your chicken, or bombard your farm with antibiotics. Work hand in hand with veterinary doctors. They are in the right position to tell you when to treat your animals with or give antibiotics to your animals, and possibly vaccinate them, so that even all these sicknesses that you are trying to prevent, they won't even get to them at all. Keep your environment clean. Keep your environment clean. Okay? So that you will not be breeding germs around you. And then stop using drug. If you feel you are feeling cold, you are having cough and all, go to a doctor, go to a pharmacist, go to a doctor. Let them be the one to prescribe drugs for you. Stop prescribing drugs for yourself. Together, we can beat antimicrobial resistance. Together, if we join hands together, we can beat it. So, do like, share, subscribe, comment, equally ask questions. Okay, see you in the next one. Thank you.